I'd like to thank everyone for their attendance. The program was reformatted to live stream, so thank you for your flexibility and joining us virtually. Thank you we look forward to seeing you in person next year. So a few housekeeping things that we need to take care of before we get started. Conference presentations are available at nortoncme.com. You select the conference details/presentations and then this activity. Evaluations and attendance. You will complete an online survey. The link is located on nortoncme.com. Which will be provided in the chat notes. And if you're registered for the symposium, an email link will be sent out that's following the program. We're also providing American Board of Internal Medicine Maintenance of Certification credits. Physicians are certified by the ABIM can receive this credit by completing the MOC online survey on the Norton CME website. There are two ways for you to communicate with us during the conference. First, the question and answer box. This is where we really want you to submit any questions that you have for the speakers throughout the day. Following each talk, we'll have a few minutes for Q&A that will we will pull the questions from here. In the chat box section, that's if you have questions for the CME team. So things about logistics, any other comments, how to receive your CME credit, etc. Now, before we get started, we're going to start with a couple questions. So first, have you traveled for vacation this year? As we launch this poll, we'll wait until we get nearly 100% responses, and then we will let you know what the results have been. Okay, so for the next question, have you attended the primary care update prior to this year? And lastly, from where are you joining us? Thank you to everyone for their participation in our questions. So now we'll move on to our speakers. Starting this morning off will be Dr. Brent Wright. Dr. Wright is the Associate Dean for Rural Health Innovation at the University of Louisville School of Medicine, where he serves as Professor and Vice Chair of Rural Health within the Department of Family and Geriatric Medicine. He is the current board chair of the Foundation for a Healthy Kentucky and immediate past president of the Kentucky Medical Association. As president of the KMA, Dr. Wright traveled across the state to gain insight from physicians and healthcare leaders prior to focusing on the association's response during the COVID-19 pandemic. Leadership and service have been the guiding elements of Dr. Wright's work as he has served as president of the Kentucky Rural Health Association, president of the Kentucky Academy of Family Physicians, and board member for Leadership Kentucky. In his professional role of vice chair for rural health, he has helped educate over 80 board certified family physicians within the University of Louisville Glasgow Family Medicine Residency. Along with his longstanding work in Glasgow, the University of Louisville Owensboro Family Medicine Residency welcomed their first class of residents on July 1st, 2020. Dr. Wright helped lead this effort within the University of Louisville School of Medicine and Owensboro Health in an effort to strengthen family medicine within this region of the Commonwealth. In his role as Associate Dean for Rural Health Innovation, Dr. Wright has used his collaboration skills to promote the advancement of HRSA funding targeted towards the needs of the aging population within the Commonwealth. Within this work, he helped create and disseminate a unique model for measuring success in treating the elderly within interdisciplinary teams. With the resurgence of interest in telemedicine brought forward by the recent pandemic, Dr. Wright is currently evaluating and guiding development of novel approaches to telehealth. He has spoken nationally regarding the work with smart glass technology for use as a telemedicine delivery tool and continues his investigative and consultative work. As a member of the New England Journal of Medicine Catalyst program, Dr. Wright is an advocate for making a difference with your skill set no matter where you live or work. He remains in constant demand for his creativity, insight, and around significant challenges facing healthcare. The presentation will feature an interview with Dr. Jim Frazier, Vice President for Medical Affairs and Quality for Norton Healthcare. In his role, he is responsible for the functioning of the Medical Exec Committee. Prior to joining Norton Healthcare, Dr. Frazier was a hospitalist in private practice. Dr. Frazier is double board certified in internal medicine and pediatrics.
All right, thank you. Are we up? Are we ready to roll?
All right. Well, thank you, Jim. I've got dual Jims this morning, and
That's right.
I appreciate that kind introduction, Jim. And I go ahead. I'm going to work through some technology here, Jim, as we get started. Let me work to share my screen. A lot of moving pieces here. So you tell me if you're able to see my screen.
Yes.
Okay. Now I want to confirm with you if you're seeing our solo slide or are you seeing multiple slides?
Multiple slides.
Okay, let me try this. Now, how's it look?
That worked.
Is that good?
Good.
I just want to make sure you've got one slide up. All right, very good. Well, thank you all. I just want to share my deep appreciation to Norton Healthcare for asking me to be your keynote speaker this morning. I'm really excited to be here with you and talk with you. I would love to be with you in person, but this virtual format, we're going to make this work and have a good time. I hope everyone is comfortable either in their office or at home. And I want you to, more than anything, I want you to enjoy this presentation and the following discussion that Dr. Frazier is going to help us with. But the title of this is Kentucky's State of Health, and what will you do about it? I have no disclosures for this program. And I had a few questions here that I wanted for the audience, and maybe Karen or Jim, if we want to do those now or we can do those later, just tell me. But these, I'll put these up there. Okay, here we go, good. What do you believe is Kentucky's greatest health challenge? No right or wrong answer here, just share your opinion. Looks like substance abuse won out a little bit over diabetes. Cancer and incarceration last. Very good, thank you. Outside of the exam room, how active are you in addressing health issues facing Kentucky? Very good. That's sort of what I was thinking we may see. And this put up the third question. Which one of these challenges would you approach first? Looks like obesity and diabetes won out over the other ones there. Well, good. Thank you all for sharing that. That helps me greatly as I go into our presentation here. So we're talking about Kentucky's health, Kentucky's state of health. So here we are. I don't think anyone's going to argue that Kentucky is a healthy state. You know, if you look at any indicators, if you look at any of those rankings that come out, and you'll see them in the newspaper, they'll be picked up by the Courier Journal, Lexington Herald Leader, ranking the states. Kentucky usually never ranks in the top of states. Usually we're in the bottom quartile. But, you know, I think what we will say, and what I'll say and advocate for today, is that Kentucky really is a wonderful state. And I'm not here to look at the downside. You know, I'm here to encourage you all to do things that are going to help Kentuckians and assist the health of our Commonwealth. You know, again, Kentucky's a wonderful state, and I think you'll acknowledge that, you know, in our state, we understand championships, and we celebrate March Madness, and we mourn when our teams lose. And we understand that champions, when you get that championship banner, you want to hold it high, and you want to put it up there, and you want to celebrate it. And we understand greatness. On the first Saturday of May, we bring forth the greatest 2 minutes of sports. And the world stops and celebrates Kentucky. Our pageantry, our brilliance, our beautiful state, how we come together. Again, Kentucky and greatness. You know, and even when we have those times that we get together as family and friends, you know, I believe we make a pretty good product that we enjoy, one that's celebrated worldwide and one that's really important for Kentucky's economy. And, you know, and you can't forget our agricultural heritage. You know, our agriculture brings forth many students to our universities, and you can't escape talking about Kentucky without acknowledging its agricultural. So look at our state, a beautiful state, beautiful time of year. You look to the east, the mountains of the east, you go to the middle portions, the central portions of the state, rolling hills, flatlands, and even coupling that with the wonderful aspects of our cities that people can enjoy and come together. But you know, we're here to talk about the healthcare of Kentucky, and we have challenges. And in my work throughout the state and dealing with these challenges, sometimes people get lost in dealing with individual issues rather than thinking about things collectively. And it is a difficult path. We've got a lot, as we will see, we've got a lot of challenges, a lot of opportunities. So before we act like Kitty Quixote here and start charging at windmills, we need to get ready. We need to get prepared, and we don't need to go about this foolishly. You know, in Kentucky, sometimes we get excited and we don't pick the right tools for the job, because it's a big job to face healthcare, to take on healthcare in our state. And you know, many of you have been in the ER, been in urgent cares, been in your offices. It's probably fair to say that sometimes we don't make the right decisions as a state in regards to our health. Even when we try to do things that are seemingly healthy, you know, we may couple those with behaviors that are not. And there are aspects of our behavior, there are aspects of what we do that causes great problems, you know, even takes away our liberties and our freedoms. And this doesn't have consequence just for ourselves, just for an individual. It has consequences for families. And as many of you stated in the question that was asked earlier, we do face issues with substance abuse, significant issues. And the importance of talking about health issues in Kentucky's state of health is because these issues don't just affect one individual. They don't happen just in the exam room. They happen in communities, and they happen in families. And that all works together, because health is just not an aspect of a system. It's not just the aspect of an encounter. Health is pervasive to all aspects of our society. So in putting this all together, if you start listing Kentucky's healthcare challenges, you can easily get inundated. You can get overwhelmed. So when I was putting this together and thinking about how can I share this, how can I convey my love for our state and my desire to make the health of our state better, so that maybe you can just do a little bit more. Apply your skill and knowledge to work forward. I broke these down into 4 domains. And in doing that, I hope you never look at a stop sign again, because it's going to be pervasive and you can't get away from it because we all have to stop. So in going through this, I'm going to go through my S, and that's stress. You know, we live in 2020, and 2020 is pretty much synonymous with stress. Whether it's political or whether it's pandemic, it's fair to say we've all enjoyed our share of stress this year. But you know, these 2 examples are situational stress. The stress I want to highlight in Kentucky is generational stress, stress that is chronic and long-standing. You look at one of our health indicators, you look at cancer. You know, I talked about hanging banners for championships up in one of the first few slides. You know, we understand that. We like to do that in basketball. But you know, we've won this championship. We're best in the nation here in cancer deaths per 100,000. But we can't afford to ignore this. We can't afford to put our head in the sand. You know, whether it's as healthcare leaders that we are serving in primary care, or whether it's individual patients who may have worrisome symptoms, we've got to pay attention and we've got to be involved and engaged. Although we don't lead the nation here, depending on the year, somewhere we're between 7 and 9 in the nation. But for Kentucky, this kills more Kentuckians than any other disease state. And as we talk about these, as I mentioned cancer, and as I mentioned heart disease, you may think of these as adult issues. But you know, in talking about stress in Kentucky, I want to make sure you understand ACEs. You know, and I'm not talking about ACE inhibitors. I'm talking about ACEs of childhood, adverse childhood experiences. You know, because as we face issues in Kentucky and we look at our health, you know, you get to adulthood going through childhood. And the experiences we have in childhood affect who we are, affects who we become, affects how we lead. This is not something that Kentucky can claim to be proud of. Again, a statistic where we lead the nation. And as we talk about children, we can't forget our elderly. We can't ignore this demographic anywhere in the nation, in rural areas or in metropolitan areas. And Kentucky has plenty of opportunity here as well, according to America's health rankings. So again, the construct here is stop. We've gotten to the stress, we've gotten to tobacco. So many of you may say, you know what, I'm in primary care. I know this, I understand this. Smoking's not good, tobacco's not good. I counsel my patients. Come on, you know, I understand this. I tell you what, I was there with you. I've been there with you. You can look at it as a personal problem, throw your hands up. It's not mine to deal with. But you know, I've seen firsthand in work that's been done throughout the state that you can't forget about this. And you've got to go after it again, because look at what we're up against. If this isn't low-hanging fruit, I don't know what is. And again, as we look at chronic disease on a continuum, if you look at our state over generations, smoking starts somewhere. And if you have 1 in 4 adults smoking in this state, it's fair to say that the children are going to be exposed to that. They're going to be tobacco products in the home. And they start sometimes, maybe not as young as this picture. But they are starting. And our high school student tobacco use is 3% above the national average. 8.9%, not the same as the 24% for the adults. But that's not the direction we want to move. And again, as we talk about tobacco, I use tobacco as an umbrella for nicotine products and vaping. And vaping, while we don't exceed the national average, we're actually about 6 points below, national being 32.7. Kentucky's vaping usage is 26.1. We're getting there. And I think the reason we're not higher is probably because of the high access to tobacco products, and likely because of issues relating to economic resources. So we've got the S, the T, let's go on to the O, obesity. Who doesn't like a good hamburger? Who doesn't like a good meal? But, you know, we have to pursue that in moderation, and we have to couple that with good exercise, good nutrition. You know, this is not the staple of a healthy diet. And what happens when we, you know, get past a few pounds, we get into obesity, our BMI creeps from, you know, 30 point something to 38 to 40. You know, that has more consequences than just being obese. Hypertension, obesity, you all know these conditions. You'll hear more about them later today. But it affects our health. And it's one of those basic issues, you know, we're here to talk about that we can't forget, because we have to move on these together. It takes coalitions. It takes consortiums. So obese adults, 36.4. You know, that far eclipses tobacco at 24%. And then look at our young people. You know, I call this slide the Kentucky dilemma. You know, not only do you have obesity, it looks like there's back pain, it looks like there's stress, maybe depression, maybe anxiety. I just ask you the question, is this individual ready for a healthy, productive life at a young age? You look at obesity in high school, again, that continuum from childhood to adulthood, 18.4%. The march goes on to that mid-30s number for adults. So I've taken you through the S, taken you through the T and the O, and here we come to the P. I think the big issue, I think one that's very challenging, even for people who are very educated in public health, who really, you know, do this day in and day out. You can talk about social determinants of health. You can talk about other issues, but we're going to talk about poverty now to end out our stop. You know, and while this is a beautiful town, it's not an economic hub. You know, it doesn't look like it. It may be a great place to stop and go to a gift shop, maybe have a cup of coffee, you know, maybe have a piece of pie for Thanksgiving. But this is not economic growth and economic prosperity. You have to think about when you're born in Kentucky, you know, the coverage charge is 3 years. 3 years less than the U.S. life expectancy. You know, and the reason that I stress poverty is because poverty is the basis, you know, for other challenges. Poverty is the platform, and you don't want poverty as your platform because you don't get good results. Again, this statistic, if those of you who are Googling at home and looking up health statistics, that's the challenge with giving any kind of talk. You can find, anybody can find a better statistic out there or a relevant statistic. This is actually conservative to some of the last few I looked at. I've seen Kentucky as high as 37 deaths per 100,000. So poverty, what does poverty look like? You know, I want to share with you, poverty is not just being poor. If we lost our money right now, we'd be poor, but we wouldn't be in poverty, we'd be broke. Poverty is something more. Poverty means an absence of resources, multiple resources, not just economic. It means an absence of skill sets, and it means an absence of hope. If you look at children in low-income families in Kentucky, it's 47%. I hope you're astounded by that number. Hope you're even more astounded that that's an improvement. 1 point, but we've improved. So what does this all mean, Kentucky? What are some of the downstream effects of this? Children in foster care is on the rise, up from 35.3. How can we be optimistic adults if we're not helping the foundation of adulthood, which is childhood? If you look at children exiting foster care, people taking in children, working with them, and then getting them back to their families as their families repair and get ready to take those children back in, you would think that that number would be growing, but it's not. Children exiting foster care is at 36% for our state, and that is down 5 points from 41%. So just take a deep breath there. Let's pause. I've given you some pretty heavy statistics here about our state. Again, this is going to be about possibility. This is not going to be about looking down on Kentucky. This is a very positive message for Kentucky because this is the state of health, and that's what I want to bring to you. But, you know, rather than me ask you, what will you do? Maybe what more can you do with the phone call, or maybe a better alliance with an organization, or, you know, maybe more informed in your conversations. You know, rather than me ask you, what will you do about it? I'm going to ask her to ask you. So where do we fit in as primary care? You know, we're where the rubber hits the road. We make a difference. We see these problems. We operate. We exist at the intersection of these problems. You know, and we have to be the ones to say stop. You know, 'tis the season. We're getting ready to celebrate the holidays. And I would tell you, this gentleman doesn't exist for Kentucky. He's not there to bail us out and provide unlimited resources, because Kentucky is, although a great state with wonderful spirit, our economic resources are challenged, and we don't have unlimited possibilities with our financial resources. And I want to go on the record today. There used to be a term passed around the state called the Kentucky Uglies. Well, I really would love for that term to go away, because I think it's too negative on what we can do. And I would really rather you talk about and leave this thinking, what about the Kentucky possibilities? You know, how do we work together as a team? How do we function, and how do we, you know, utilize interdisciplinary teams, people with different skill sets, to make sure we get the best care for our patients, whether it's at the community level or whether it's at the individual level. You know, we can't afford to be complacent. We can't afford to rest on our laurels and just think it's not our problem, it's somebody else's problem, because look what happens. Premature death per 100,000, 9,000 years, over 9,000 years. We have the possibility to do things in our state. We have a great agricultural tradition. We produce fresh fruits and vegetables. However, we have to balance this with the fact that we're the state that branded comfort food. You know, we have to think about moderation. We have to think about what we're doing. So I encourage you to stop before we get going with some of Kentucky's issues, because sometimes we can look at problems that are more of a niche variety, that aren't as pervasive, but these are pretty large problems for our Commonwealth. And I think if you look at anything, I believe you can relate them to one of these 4 domains. Now, again, we understand championships, and I hope we get back to that first Saturday in May that we can celebrate together. And we can win this race working together. But we're behind in some areas right now, and we've got some work to do. But I want to remind you why we do it. We have a lot at stake for our Commonwealth. I've enjoyed participating in activities that help to move our state forward. I've seen our state move forward through some very positive, hardworking organizations. And I know I want to appreciate you this morning and thank you for your work in primary care, for how you serve our patients and our state. I look forward to now to doing some questions with my good friend, Dr. Jim Frazier. And feel free, if anyone wants to contact me, send me an email. I'll be glad to talk to you offline. Thank you. It's been an honor to present to you this morning.
Thanks, Brent. I really appreciate you taking the time out to speak to us this morning. So appreciate the information there. Certainly sobering facts about our state. So what is going on with the health in Kentucky?
You know, you can see we've got multiple challenges, and we've got a lot of people out there. One of the greatest things that I see, we've got a lot of stakeholder groups out there that want to do everything they can. And you look at how Kentucky is broad. We've got 120 counties. we've got diversity in our government. But what I don't see is a lot of people working together as a team. Everybody's got their own piece of the pie, but sometimes they don't communicate. So what I've seen and what I've tried to work towards in the past, 2 to 4 years is getting more people to communicate, because what I have seen is being active in multiple stakeholder groups is those stakeholder groups often don't communicate, and you duplicate efforts. So if you're duplicating efforts among limited resources, you're really wasting time and money, something that Kentucky can't afford to do. I've seen millions of dollars squandered, on initiatives that just weren't well aligned with what the state needed, or it happened to poorly align with what was happening with maybe an administration, because things do change in our state with administration. I think we have a lot of wonderful leaders in our state, in our cabinet and elected officials. However, sometimes priorities do change. So that's why I encourage, people here to understand, be a part of an organization. If nothing else, just get an email and understand what are common issues that are coming forth, whether it's to the legislature or important to your organization.
So why does Kentucky have so many health issues?
I think it's really the P in my stop analogy there. I think it's poverty. I think that, with limited resources, I think you have limited opportunity. And I think it's hard for a percentage of our population. If you look at children in low income families, 47%, it just doesn't create opportunity. I mean, if you don't have fuel in the tank, it's hard to go far. And that leads to so much. And, when you get into poverty, I think, some people may be saying, well, I think education is the main thing. Yes, education is a big part of it, but I see education as a subset of poverty, because within poverty, there are generations that families don't want to aspire to, let's say, be in a college education. I don't know if your family, my family, other people's, I would say all of us were encouraged to go on and get the training, to work in healthcare. But, some families actually, because they haven't achieved a certain level, they're worried that their children are going to achieve a higher level because they're going to go beyond them and they're not going to be the same. They're not going to be their children. They won't know them, and although that may sound somewhat perverse, but it's really not, in the sense that, Kentucky's strength is its familial relationships. And the last thing you want to lose is family. So I think that's something we have to take into consideration. I think that falls, that's why I say working together, because education, we really have to work at that. Our high school graduation rates have actually gone up in this state. That's something Kentucky will be lauded on. I mean, education reform has been very strong, but, in education, one of the challenges those children will face, especially rural children in Kentucky, is the fact that when they go to college, and when you place a rural child in a larger university where they're around children who may have been grown up in more sophisticated environments, they're going to have social issues. They're going to have social challenges because they're going to come from a different background than what those children are. And it affects them. It's not just about making the grade. It's also about being socially engaged.
So, we have 3 medical schools. We have a lot of talented physicians in this state. Why aren't we healthier?
It's not just, doctors play a role of it. Our healthcare providers play a role in it, but it's not just them. I learned real quick sort of the why and what I do. I learned it in my first year of residency. I conducted probably the best physical exam I thought that I'd ever conducted. And I'm dating myself here because I had it on paper. I can still see it to this day, that there was very little white showing through on the page. I'd written so much. I thought I had covered everything and I was going to make a difference in this individual's life. The preceptor was happy. Everything was good to go. I went to talk to the patient about the workup. They said, I can't afford it. Can't do it, doc. I'm sorry. I can tell you, I can still remember that moment because it was a dual disappointment for me, because not only could this patient couldn't utilize what I had worked to provide for them, it was blatantly obvious to me that there were forces beyond the exam room that were controlling what I was doing and what I was able to do and everything that I trained to do. So rather than being a point in my life where I thought, here I am, I'm going to get better at where I find myself, I was at a point in life that I said, here goes my next journey, because this is not my destination. This is a place to where I learn and then I will continue from. So that's my why it personally. But, you know, I have seen, and I know that doctors can't do it alone. I can't do it in my office without my team. And sometimes the most influential person in our office may be the kind voice on the phone from the receptionist, or it may be our nurse that they went to school with them, or it may be another patient. I find that patients respond really well to peer patients, you know, to people who have that shared experience. There's a lot of discussion now as we deal with issues in society about shared experience. And I think a diabetic who has, you know, experience of being diabetic needs to be an ally to other patients with diabetes. I think we need to bring them in and utilize them in multiple ways. There's examples out there, and everyone can go forth and try different ways for their populations, because you have to act locally.
You know, Brent, for those who don't know on this, they're listening to this speech, and we've known each other for a long time, since the first day of medical school, as a matter of fact. So I've had the pleasure of watching your career over the years, and I know you've been involved in many organizations, the KAFP, KRHA, the KMA, and now the Foundation for a Healthy Kentucky. What's driven you to be so involved?
You know, thanks for that, Jim. And I will say to everyone, yes, we do go back away, same unit lab at U of L, and enjoyed our times together, and enjoyed seeing your career as well. But, you know, what drives me in this is the fact that there's more to do. And while I thought that maybe getting the diagnosis and writing the scripts and getting the test and doing the follow-up was the end for me, I felt that I could do something more. I felt called actually to do something more. I enjoy leadership. I enjoy bringing people together. You know, I enjoy trying to give a voice, not being critical, but I think providing appropriate feedback when I see gaps and when I see things that need to be done, that could be done by multiple people working together, because singular effort will bring burnout. You know, I think we're seeing that in our profession. I don't know if you're, you know, I'm sure you have remedies for that or tools for that at Norton's, but we see it all throughout the state with our healthcare workforce. You know, there's an element of burnout. And I think that element of burnout comes from you know, not leveraging resources that may exist out there, because the healthcare burden is so great in this state. I don't know that we can train enough doctors. As one point is we don't have the number of residency programs to retain the number of physicians that we graduate. So Kentucky, I will say this, Kentucky is an exporter of medical talent, because we graduate more physicians than we can keep. So that, you know, to the question, that's a point that does need to be made.
So, you know, we're getting a lot of questions from the audience, by the way. So I'm gonna
Please
mix in some of those, just so we try to cover as much ground here as we can in the next 20 or 30 minutes or so. But how do you find time to do it?
You know, again, I think find time. I think find time and make time. You know, and part of it is I'm supported in my role. I feel like I chose a role. I chose a path in medicine to where I felt like it was synergistic. You know, about community engagement and, you know, building within a residency program, educating residents. It's a natural fit. Also, you know, it's not always just finding time or having time carved out. It's making time. You know, sometimes the late calls aren't easy. Sometimes the weekends away aren't easy, you know, to attend and make time. And sometimes even the more you take on leadership wise, the more responsibility you take on. So I think it's a calling. It's a passion. You know, I feel like it's a way that I can give back to a state that's given a lot to me. I feel like it's my best skill set. You know, I can be in and out of the exam room and I still see patients. I'm still responsible for patient care. However, I feel like when I'm able to do what drives me, I feel like what I'm able to do is a multiplier effect. You know, I feel that there's a multiplier effect in education by training residents. I feel like there's a multiplier effect if I can do something with an organization that changes policy, which helps to raise a tobacco tax, maybe decrease youth smoking, increase flu vaccination rates, promote smoke-free schools, as was done with the KMA and the Foundation for a Healthy Kentucky with their initiatives. So I think that's what drives me. That's how I find time to make time, because I think the outcomes really make it all worthwhile. It's not always easy.
We're getting a lot of questions here that I'm not sure that we're going to be able to solve today, but we're certainly getting a lot of questions about solutions.
I love it. I love it. Let's have them.
Specifically around resources, whether it's obesity, poverty, or really getting a lot of questions about the opioid resources, opiate recovery resources that are out there. So you may or may not have a lot of insight into that, but I'm going to pass along those questions from the audience.
Okay, so it looks like I'll take that in a couple of different areas with obesity, and as well as with substance use problem that we have within our state. I think that with substance use, it's multifactorial. I mean, we could have spent the whole day. Norton's could dedicate the whole day to substance use disorder and substance use. And I'm going to answer first the obesity thing. I think that's as much a community issue as anything. I think that's school. I think that's community. I think that's more pervasive. I think we need, you have, walkable communities, you have safe communities. And while, yes, that takes effort and that takes money and that will take public resources, you have to move forward there. And you have to have kids, you have to have children understand, and you have to incorporate families into this. It has to be a priority. You saw the picture of the young lady holding her back, bending over, looked like she had a backache and a headache. That's just unfortunately not an uncommon picture. You see individuals like that, throughout our state. You go out and you see that, and it's that collective effort. And you talk about weight loss. I mean, you've got sort of the end result. You've got bariatric surgery, but while that's an effort for some, there's still downstream effects there. I think we need to be more proactive. Quickly. I think that we have to promote positive body images. I think that's without a doubt. We can't be shameful by any means, but we have to help people at all levels. And it's not just physicians. It has to be multifactorial. Again, going back to my picture of the car, it has to be a team-based approach. And the other thing, the challenge that I see, it just can't be one effort. It can't just be child youth advocates. It can't be Foundation for a Healthy Kentucky. It can't be KMA. It can't be Kentucky Academy of Pediatrics. It's got to be everybody moving in the same boat, because you're going to have to leverage public resources, and to leverage public resources, you're going to have a team to work to leverage and gain attention. That's really not that hard. You need to get about 200 people on an email listserv, and about 5 to 10 to be leaders of that initiative, and you'd be surprised what you do. Numbers speak. And on the substance use issue, Jim, I just want to pay tribute, to my friend, Dr. Couch, who's honored today. And I believe we've got, topics on that specifically, and they're greater content experts that the audience will be hearing from today. So, I'm not going to be fair to other questions that may come in. We may come back to it at the end if there's time, but I'm going to yield to some of those content experts who may have more specifics to give there.
Okay. I think you hit on some interesting things there, particularly around the email lists and those sort of things. I think we should probably explore a little further. But what can our physicians, and not only our physicians, but our advanced practice providers do specifically, either in the exam room or beyond the exam room? How do they work together to solve these problems?
I think that's a great question. I think if you look at these issues, these are very basic issues, and these are these are issues that need to be hit and hit and hit again. They need to be hammered after. And, these providers are well equipped, to go after these disease states such as obesity, such as stress, hypertension, diabetes, all of these that take that fine-tuned management that can be used as a building block to helping people be healthy. Now, again, I stress that in a team approach.
So let's shift gears here for just a minute and let's talk a little bit about innovation. So what are some of your main interests and how do you see them making an impact on Kentucky?
You know, thanks for switching gears there. I mean, it gives me a chance to talk about what I do. You know, telemedicine became such a big part of the pandemic, and it allowed me to, you know, take up a project that I'd been working on before. Many people have heard of Google Glass. Google Glass got a really bad rap when it came out about 5 years ago, but we did some initial work with it, and it's a great telemedicine tool. And what we did at the beginning of 2020, the pandemic hadn't started yet, but we started working with a company out of New York, and you know, they made a smart glass solution. And for those of you, you know, that don't know what a smart glass unit is, or smart glasses, basically think of, you know, just traditional eyewear, and you'll have a camera and a microphone there on your eyewear, and you can put that, whether it's on a layperson, a caregiver, a visiting nurse, into the home, and you can connect back into the physician's smartphone. So we're doing a project right now. We just had a successful home visit test this past week. I mean, it was wonderful how the team went to the home. I get a text message and I can be right there in a telemedicine visit with the team seeing a patient in the home. So you can apply this to really anywhere. You can apply this to emergency room situations, critical care. You can apply that to nursing homes, having a real challenge with COVID-19. So, you know, that's one of the innovative things that, you know, we've been able to do, and just a lot of joy in taking on that type of novel approach to telemedicine and technology.
So I know over the years you trained many board certified family physicians, probably close to 100 now in your role as a teacher and professor. What can you talk about the importance of primary care?
You know, some people may say, you know, primary care is dead, or people may be discouraging people from primary care, but I would say primary care is not dead. It's alive and well. And I think that it, like anything that's really good, and assumptions can be made about it, it really represents the greatest value for our healthcare system. And we, you know, I'll speak from a primary care physician, and I'm not disparaging any other specialty. I need multiple specialties to help take care of our patients. But if you look at primary care and primacy, and the foundation of what we represent, we really have to be there to serve our patients, because so much can be taken care of, our skill set, before moving on. And again, even upon referral and coming back, referring physicians can't take on a primary role. They're looking at the problem for referral and then referring back, and then we manage. I'm really amazed at how much greater the complexity is for patients than when I started practice. You know, I think we have so many new drugs. I think we, you know, the immune modulators, the biologics that are out there is just really incredible. And our life expectancy has gotten greater, but also the demand on our medical knowledge as well. So primary care is alive and well, and it will continue. Primary care is an awful big tent. You know, I will say we had to be fair. We had to be fair, you know, to who occupies the different roles, but, you know, primary care is very important to not only health systems, but the public at large.
So with all your involvement in many areas, where do you think we're going in healthcare?
Where do I think we're going in healthcare in general?
Yeah.
That's a great
just in general.
Yeah, I think that I think it's going to be interesting where we go with this inflection point with COVID-19, because, you know, 20 years ago, 25 years ago, the time's adding up from when I got out of med school to now. You know, you thought telemedicine was going to be a big player, and if you look at the stats on telemedicine, it's really been suboptimal in its utilization. And I'm interested to see how telemedicine virtual care is going to go from here, because the challenge for healthcare is if we get into an Uberization model to where you've got people for hire and people have problems and they just go out to the internet and they just say, I need a rheumatologist, you know, I need an endocrinologist, and somebody's out there just picking that ticket up. That's going to be a challenge to systems, although I still think people are going to want to be within their system. But it's going to be interesting how that plays out, because I think that the millennial generation and how they, they're digital natives. They grew up with computers in their hands. Children grow up inherently knowing how to use a smartphone. That's the way they're designed. They're not going to accept the model of waiting, 30, 45 minutes in a doctor's office. And they're going to like being able to have that access point. So I think that's something that healthcare is going to have to grapple with. And you look at other industries, healthcare benefits from being a laggard. We don't adopt things the same as other industries. You look at automobiles, automobiles now, car dealerships have to attend to service models. They have to provide service. If not, people go on the internet and they'll get the cheapest car. They know what they want and they'll price shop. So I think that consumerism in healthcare, although I've never been a fan of that term, I think patients will look very closely how they spend their healthcare dollar. And I think that we're going to see, Kentucky is still, healthcare is a laggard, and then Kentucky's a laggard in just how they adopt. So our healthcare indicators, they will move. I just want to see them move in 5 to 10 years versus 20 years, because eventually we will move. But I just hate to wait 2 decades to see us get to where we need to be.
That's a very good point. We're getting a lot of questions and a lot of comments about COVID-19, not unexpectedly. Mm-hmm. Let's just start with what did COVID-19 teach us?
I tell you what it has taught me, and a big reason why I constructed the talk like I did is that we had chronic disease prior to COVID-19, and COVID-19 really loves chronic disease. But yet everyone still wants to talk about COVID-19 and not about the importance of chronic disease. And I've been in meetings where, my hands are raised and I'm like, it really is about chronic disease. We need to talk about, but it seems the appetite for chronic disease isn't quite there. It's all about COVID. It's just human tendency. We tend to go to what the most sensational thing is at the moment. But I can tell you, obesity was a big issue. These numbers that I gave you today are pre-COVID numbers. These statistics lag, they're going to be 2 to 3 lag. These numbers are big before COVID. These numbers are going to be big after COVID. Obesity may be worse after COVID. I mean, personally, ice cream and potato chips, were very popular in our household to help us get through, the stress of COVID, unfortunately. But, that stress drives unhealthy habits. And I think we're going to have to have a discussion there. Again, basic things like the flu shot. I think preventing the flu so we don't have to try to worry about diagnosis of flu and COVID as we head into the winter months. So yeah, chronic disease, that's what I'll say. COVID-19 is stress to me. Chronic disease still matters, and we can't take our eye off the ball there.
Okay, let's on that note, I've been working closely with the KHA and the state on the vaccine. I don't know how involved you've been in those conversations, or if you've been in those conversations, but what's your thoughts? I know you don't have a crystal ball, but for a vaccine and sort of deployment across the state, what are you looking to do to help support that?
I've actually been in multiple discussions. I think very productive discussions. And, the reason I highlight those discussions, it started out as a couple of groups coming together, and then a couple of more groups came together. And then before we even crafted an initiative, that went more towards the state for them to take a global response to it. And so to me, I believe that's very appropriate to this discussion, because it shows how groups can influence a greater impact. Rather than 2 or 3 groups just trying to do a messaging campaign, you get all the buy-in, and then you move it forward quickly to where you have a larger scale, a larger platform, such as the state. The state has many resources. So I think that was very, very effective. The vaccine, I think we've got excellent reports on vaccination. And, one of our past presidents of the KMA is working very hard in that infectious disease branch. And my conversations with him, the results are positive, and we need to be very positive about getting that vaccine. I think what we're going to face as a state, you look at the people who won't get the flu vaccine. I can't see people who won't get the flu vaccine will jump at the COVID vaccine. I may be wrong, but I think that's one of the concerns in the stakeholder meetings that I've been a part of is how do we get that population that says, you know what, yeah, I'll be more in the D round or the E round, or I'm not getting it at all. I'm going to wait for herd immunity. You know, there's still going to be people, healthcare providers, you know, first line workers, people in nursing homes. Are going to be a lot of populations going to need that vaccine. I think we have a very promising vaccine. It's just going to be that, I would call it the mushy middle, you know, how we're going to influence those, you know, the great percentage of the population to get that vaccine. But I have faith that we're going to get a good vaccine. We're going to move effectively into the second, third quarter of 21 is what I think.
That sounds good. You can't get here fast enough, that's for sure. So a lot of chatter in the audience about advocacy, about the state government, local government. What can we do? How do we get involved? What's our best mechanism? What's our best platform way to do that? How would you suggest for those in the audience who want to be more connected? Where do we start?
I'll talk on a micro level, individual, if you want to go that, and it starts here. You know, they have to know you. You know, they oftentimes do meet and greets, or they'll have some opportunity. It's good for them to know you, but outside of that, not wanting to take that time. I understand time constraints. I understand personal bandwidth. Then the next thing is I'd work with your societies, you know, GLMS, KMA, you know, ones that I know, ones that do a very good job, Foundation for a Healthy Kentucky, Kentucky Youth Advocates. Get involved with an organization about an area that you're passionate about. And then just ask that they, you know, form coalitions. You know, the political process, it really is an advocacy process. And I love advocacy. I don't really like talking about politics because it takes on such a bad tone. People don't like talking about politics. But you know what, it's what we deal with. It's how decisions are made. So whether you want to be personal or not, that's fine. That is an option. I think it's good for them to know you. I think it's good to have a relationship. If you want to call them, I think as a very important healthcare worker, I think they should take that call. I would stress that you become that person where they want to take that call and make your voice. You just be surprised. There's something in Frankfurt called a legislative action line. And I want people to understand that legislative action line, it's not often burned up. And when you've got an issue, you call that number, a very nice individual will pick up the phone. They'll ask you who you are, where you're from, verify your address, and they'll say, what message do you want to leave? And they'll take that message down and that will get delivered. It doesn't go into any file 13 or anything such as that. Those messages get delivered and they'll be put on a policymaker's desk and they'll look at the issue and you can talk to any of them. Sometimes it can be 5 to 2, 7 to 3, and people calling in. And they know that those people who take the time just to make a phone call, I'm not asking for you to take out 20 hours a week, 10 hours a week. This takes about 5 minutes. Your organizations will queue that up for you to allow you to be an effective advocate. And sometimes it just takes a call. I'm not asking for you to change your career here. I'm asking for you to, 1, be aware, and 2, a phone call at best, or get signed up for an email newsletter to be more informed.
Excellent. Thank you. I will say we're coming up on about a 5-minute warning here. We're going to try to stop a little bit before the hour to give everybody time for a bio break, et cetera, so we can stretch and get ready for the next lecture. But yeah, I've heard you say before that primary care is dead, but long live primary care. And can you tell me a little bit about that statement?
Yeah, in preparing this talk, and doing talks, sometimes I like to be a little controversial. I like to get, you got to get people, you got to wake people up. So when you start talking about that, people are like, hey, that's, you're goring my ox there. You can't do that. The primary care is vital. And I say that because I think sometimes we feel challenged in primary care because we don't feel important. What makes the first page of a magazine is somebody, you do a heart transplant, or you do a hand transplant, or you do a face transplant, or you do something that's just unbelievably innovative. for one individual. But I tell you, if you take care of someone's hypertension, you may give them 20 more years with their family. They may see grandchildren. They may see great-grandchildren. You take care of their diabetes, they're going to have a better quality of life. You allow them to lose weight, they're going to have more mobility. They're going to have a more functional, beautiful life. And that's hard to be measured. I don't know that we're ever going to see that on Time magazine. Family physician, primary care provider gives individual 20 years of life. Primary care physicians give America 5 million more years of life this year alone for their actions. But I tend to believe that's the truth. And that's why I say long live primary care and avoid the naysayers. Don't buy into the haters.
All right, let's do one more here, and then we'll take a small break. So, still a lot of questions about resources out there. A lot of questions about how do we, what email chain do we get on? How do we organize this? And it sounds like you may be organizing a grassroots effort here today. And I'm sure you'll be able to provide some of these answers. We're getting chatted back and forth. I won't go through all these today because there's several on there, but. If we can provide the audience after this with some degree of resources, just websites, any links that you're aware of, and if you have any additional comments for our audience here before we close.
I love it. I hope the audience has gained some benefit out of this. Again, I'm so appreciative to be asked. I mean, it really is humbling, to be before your peers here and provide some information. I would say start, to me, the bit you saw in my bio, Kentucky Medical Association, very important to me. Foundation for a Healthy Kentucky, very important to me. I don't think people interact with the Foundation for a Healthy Kentucky. And a lot of my stats come from the organization that they put together for those Kentucky Health Facts. So I think that's a great resource. And then I'll put some more out there. There's just great groups out there. And a lot of these groups that I'll provide for you, they're groups that are working together. So that's what I stress. I mean, don't be out there. I mean, you may be 10 people who want to change the world, and I hope you are 10 people who want to change the world, but I really need 10 people joining with 10 other 10 people to really move this. And when people are held accountable, people pursue action. And that's what I hope people understand today. And you're very powerful. Your voice is extremely powerful because people know you take care of their family. People know that you take care of the community, and people know you've dedicated your life to healthcare, so you know what you're talking about. So I hope you feel empowered this morning. I hope that you are engaged and want to get out there and do something. And I know, thank you to Norton Healthcare, because I respect the work, the quality work that you do and represent for this Commonwealth. And it's always first class. So I feel in wonderful company this morning. And again, thank you. Reach out to me at any time.
Yeah, just my last closing remarks here in the last minute. I just looked, and we've got nearly 250 people signed in to listen to you bright and early on this Friday morning. So really appreciate you taking the time out of your busy schedule to lecture us and to be so engaging with your conversation this morning about what's important to our state. And certainly there's a large audience there, and I expect we'll get quite a bit of movement from that. So thank you again for your time, and I'm going to turn it back over to Jim at this point.
Hey, great. Thank you, Jim. I appreciate it.